All right, so we are back at the STD PowerPoint. Hopefully you took the STD pre-test and turned it into the file over by the window. I took my picture off of the screen, so hopefully I'll be able to talk easier so I don't have to watch myself. We're going to start with STDs. STDs uh, are a sexually transmitted disease. So when we talk about diseases, we also call STDs sexually transmitted infections. Okay? The infection and the disease are both transmitted by sexual contact. So that doesn't mean just sexual intercourse, that means any type of sexual contact. So what does that mean? Can you get an STD an STD from shaking hands? No. How about sitting on a toilet? Sometimes you'll hear people say like, "Well, I'm not going to sit on the bathroom toilet because that means I can get an STD or something," right? Not no. You have to have fluid exchange. How about drinking from a water fountain? No, okay. Although sometimes it's gross. Lily, my 4-year-old, likes to like drink straight out of the water fountain spigot, and it just about is enough to make me hurl. But nope, can't get STDs from that. Sharing food or utensils, again, not a great idea, but nope. How about being bitten by an insect? So you would think maybe because an insect can suck up your blood, but when they bite the next person, they don't inject their blood into you. So they're just sucking your blood also through that bite. Being coughed or sneezed on, again, is a gross thing, but it is not going to transmit an STD. Touching a person's sweat or tears, although those are fluids that come from our body, they're not bodily fluids that can transmit sexually transmitted disease, an STD. Okay, so all of these things are kind of myths, things that people might talk about or try to tell you, and they're just flat out false. They do not transmit STDs. You can get an STD through sexual contact. So, what is sexual contact? Okay. Sexual contact means intimate contact, not just intercourse, with another person's lips, mouth, vagina, penis, or anus. Okay. So, just because we don't have um, penetration of the penis into the vagina doesn't mean that we can't transmit sexual fluids. So, for example, when we talk about oral sex, using someone's mouth um, to stimulate either the penis or the vagina, um, that definitely is sexual contact and can spread sexually transmitted diseases. Remember that when we talked about abstinence yesterday with contraception, abstinence also is 100% effective in preventing all STDs and pregnancy. So, as educators, as parents, as people who care about young adults, obviously um, our major concern, our advice for kids is to be abstinent, to do everything you possibly can, even though your body is giving you some signs that it might want to participate in reproduction. That we know in a 21st century society that is not something that um, teenagers should be engaging in because of all the reasons that we've been talking about. Lots and lots of teens use this method to protect themselves from STDs and to um, prevent pregnancy. So sometimes with the media, the culture, Snapchat, Facebook, okay, movies, all the stuff that you see on TV, we live in a very sexualized society. For some reason, when they try to sell you a hamburger at Wendy's or Hardee's, I don't even remember, I think it's Hardee's, um, they have to sell it with this like scantily clad girl in sexualized society because if this beautiful girl is holding my hamburger, I'm gonna want my hamburger more. Probably not. No, I just want a hamburger. I don't care who's holding it. Actually, I want to be holding it so that I can eat it. But you know that sex sells and sex excites, so a lot of the media uses sex in order to try to get your attention. But the downfall of this sexualized society, this society where we see and hear about sex a lot, um, makes you start to think that it is a very normal thing for all people to be having sex, and that is not the truth. A lot of teens are not having sex, especially a lot of eighth and ninth graders at PJ Jacobs are choosing not to have sex to protect themselves from the things that they um they know can be huge consequences in their lives. So just remember, sometimes it's hard because you want to fit in and you want to feel normal. But what you see on the outside is not the same as what's happening on the inside. And lots of teens, even though they might talk the talk, they don't walk the walk. They're not having sex. All right, so some risk factors for STDs, getting a little bit more into STDs. If you're a sexually active teen, obviously that's a huge risk factor for contracting an STD. We know that teens don't think things through, they don't take time to make good decisions, and a lot of times kind of fall into the trap of that quick judgment society. Having more than one sex partner obviously is a risk factor for STDs. So it doesn't mean that people who are monogamous, they have only one partner, can't have an STD or contract an STD, but obviously having sex with more than one person um, is going to put you at a higher risk for getting an STD. When you don't use a latex condom, that is a risk factor for STDs. So we know that we talked about condoms yesterday. Not only are condoms a barrier for stopping the semen from getting into the woman's vagina, cervix, uterus, it also stops the semen from having any contact with the woman's body, the woman's bodily fluids. So it's that bodily fluid mix that there really is the change or the exchange and the contraction for the STD to happen. So sometimes when people are taking like the birth control pill or using a different hormonal method, they'll choose not to use a latex condom because they think they're protected. But we know that STDs can still be transmitted even if a pregnancy is being prevented. Also, using alcohol or drugs. So, if you use marijuana, does that mean you're going to get an STD? No, right? Okay. Marijuana is not going to inherently give you an STD. But if you think about what happens to people who are drunk or high on drugs, you will know that maybe they're not making the best decisions that they would normally make and might be okay to do more risky behaviors. Maybe if they wouldn't have sex normally, but they are drunk, you don't think as clearly when you're drunk. So you might choose to do that in that situation. Maybe if you are sexually active normally, you would choose not to protect yourself when you're drunk or high on any type of drug. So using alcohol or drugs, not using condoms, being sexually provocative, I guess, having more than one partner, and then also just being sexually active as a teen are all things that are going to raise or increase your um, risk factor for getting an STD. Okay. Of course, all of these things can happen at once, and you're pretty much setting yourself up for failure. Okay, so you just have to be careful. All right, so we're gonna get a little bit, we're gonna talk a little bit more about the different STDs. STDs are really broken up into three different categories. So if you take a look at your note sheet, there are different categories where you're going to place the STD in the specific category. So first we're going to talk about the categories, then we'll go into um, each of the STDs. So starting out with bacterial STDs. Bacteria, remember Bacteria like to go to a party. They like warm, dark, moist places. Okay? Well, if you think about the male and female genitalia, those are warm, dark, moist places. Bacteria spread really easily in those places. Okay? One thing about a bacterial STD is bacteria can be killed with antibiotics. So these things can be treated with antibiotics just like an ear infection would. So we just want to remember that. So bacterial STDs. Okay. Oops, I guess we're going to go through each of the bacterial STDs, and then we'll go through each of the viral STDs, and then some of the other ones. So chlamydia is the first one. Chlamydia is the most common bacterial sexually transmitted infection. So what happens? Like, what is chlamydia? Like, sometimes there are some symptoms that come with it. Sometimes you have some yellow discharge from the penis or vagina. So normal penis and vagina have discharge. There's some mucus, some fluid that comes out of the penis or vagina, and that is totally normal. You might, ladies, you might recognize this when you wipe or go to the bathroom, that there's a little bit of discharge, or maybe even both boys and girls, a little bit of fluid in your underwear that's not urine. That's normal discharge. That normal discharge should be clear, maybe really shouldn't have much of a color. But if you notice that discharge starts to turn yellow or be a little bit frothy, those are all things that you might want to make sure that you pay attention to. Painful urination. So it shouldn't hurt you to go to the bathroom. If it does, that's definitely something we want to keep an eye on and make sure that you take care of. So just because you have painful urination doesn't necessarily mean you have a sexually transmitted disease. Maybe you could have a bladder infection, a urinary tract infection. All of those things are common. They are not things that happen in only sexually active people. So you don't necessarily have to worry about saying something if you have painful urination, but also don't just leave that. That's not normal. So you want to make sure that you get that taken care of. Women are going to have lower abdominal pain. So women, you know that you have lower abdominal pain all the time, or not all the time, but that could be a common thing associated with your period, with cramps, things like that. But when you start to see all of these things happening together, you want to really make sure that you are paying attention to what's going on. Obviously, if you're sexually active, if you're getting an STI, a sexually transmitted infection, you are going to be, excuse me, it was a long night. Lily was up not having such a great night, and ear infections, they're painful, and it's hard to make them make the pain go away. So we were up for quite a while last night. Painful intercourse. Okay, we talked about how there is a pleasure aspect to sexual intercourse, so that we do reproduce. Remember, that's our goal as a species. So if the intercourse is painful, that shouldn't be happening, and we want to make sure that we get that taken care of. Men can have swollen testicles. So again, that the size of the testicles sometimes changes, but swollen red testicles are definitely something you want to keep an eye on. One of the most interesting parts of sexually transmitted infections, diseases, is that 75% of women really have no symptoms whatsoever. They have no idea that they even have or are carrying the STI chlamydia. So think about that for a little bit, about why that would be so important for you to know why most people don't have symptoms. Remember that we talk about sexually transmitted diseases being transmitted between sexual contact, fluid exchange, and if people don't know they have it, how might they be spreading it?